Celebrating the baby boomer lifestyle. This is Boomer Life with Sterling Fox on AM 650.
Welcome back to Boomer Life. On this particular episode of the program, it's a real pleasure to welcome back Dr. Ron Zokol to AM 650. We're talking, Dr. Zokol is our expert in dental solutions, Ron. I guess that's an easy way to summarize. I've got Dr. Zokol's CV here on the desk, and it goes on about 50 or 60 pages. You're quite an accomplished human being, sir.
I've been around a while, I think.
You certainly have. You were talking earlier about, this is Boomer Life, and how boomers as a generation are, in your assessment, better off than our senior parents, simply because as a generation we saw the dentist more frequently while growing up?
We did, and I think there's a number of factors that relate to how we're better off than our parents. And our parents were they went through the Depression. We did
That's
not.
Right.
They went through a war. We came right after that war as
Correct.
boomers. And our parents made sure we had things that they didn't have. So we grew up with plenty.
Mm-hmm.
And we are the massive great number and when you take a look at demographics in society, boomers represent the largest population base, and they change every characteristic of that age group through which they transition. And they're into the geriatrics, seniors and geriatrics now, and that's going to be very interesting because what's happening is that these people, these boomers, and I think people who are listening to this would agree, you want to remain youthful and vibrant for as long as you possibly can.
You're right. We are the largest single population group of the 20th century. We have insisted on doing things our way from the get-go, and that's meant changing the definition of a lot of things. They've even moved the goalposts on the age of retirement, Dr. Ron. I mean, we've really pushed a lot of things around, haven't we?
We have in a massive way. So we're lasting longer with more vitality and health and stability. We are not getting old simply. We're kicking and screaming and we're saying we want to retain our youth and vibrancy and quality of life for as long as we possibly can. How do we do that? And that's why we see billions and billions of dollars being spent on cosmetic surgeries and things like that, health-related things, and our longevity, our age and life expectancy is now growing and growing. People that used to be in their mid-50s were considered really old. I'm very happy to say at 65, it's not old anymore.
That's right. That's right. The government doesn't even recognize it as old anymore.
Exactly.
Now it's 67, and Lord only knows what it's going to be in a couple more years.
Maybe I'll never get to my senior years.
Well, who knows? With a little bit of luck, right? But talk to us a little bit. Take us back to what you were talking about earlier, please, Dr. Zokol. The whole matter of how your mouth gets stressed out. It's the bite. We manage to wear down our teeth pretty successfully, although some of us are, and I hate to use the word better, but some of us are more accomplished at wearing our teeth down than others. Would that be the most stressed in our midst?
I think that would be it in a nutshell. And what complicates it, we have two things which cause deterioration in our mouths. One is bacteria, and the other is biting force. And the way the teeth meet often determines whether that biting force can be really destructive or put in balance. So people who clean their teeth still have to worry about how much force they generate on their mouth, and everybody's a little different. And you're quite right, stress plays a large role. Those people that manifest their stress by clenching their teeth will do so without even knowing. They could be attending to a particular problem that they focus on, and they're so focused, they'll be clenching their teeth and putting a massive amount of force on their teeth.
And you can see the veins on the sides of their neck popping out. They're clenching their jaw so hard.
It's very, very true.
Yeah.
And what happens is that they're not even aware that they're doing it.
True.
And you ask that person, and you see wear on their teeth, and you say, you clench your teeth? They say, no, I don't clench my teeth. I don't do that. And yet I've seen 4'0" young Asian ladies who are very small with a massive deterioration of their teeth because of excessive forces that will swear on a stack of Bibles that they don't clench their teeth.
Right.
And I know that to be different.
So we literally wear our own teeth out.
We do, in many cases. And yet, although not prevalent, there are a lot of people who are in their 70s and 80s who still have all their natural teeth and are very stable and will probably expire in however many years with their natural teeth healthy and stable.
Right.
And these people have learned not to put a lot of force on their teeth.
When you get a filling, even at the dentist, one of the things they like to do at the end of it all is they put a little, looks like the old carbon paper onto your tooth that you just had worked on and say, okay, now bite down gently, now kind of grind a little bit, and then they look at it, and if there's a mark on your tooth, they'll take that down. It's all about fitting the bite properly. And you were saying just a few moments ago, if that bite doesn't fit properly, the wear and tear factor goes right up, doesn't it?
It absolutely does. And you've made the perfect connection right there, because every dentist is taught not to overload a single tooth, because not only is it a structural problem for that tooth, because you can fracture the tooth, you can break it and therefore lose it, but also if you hit it too hard on a regular basis, you'll kill the nerve inside the tooth.
Okay.
In which case you will have an abscess, and it has nothing to do with bacteria or decay, but you'll kill the nerve and have an abscess at the end of the root of the tooth that if you don't treat with at least a root canal, you will have a massive amount of pain and problems. And
Right.
it'll eventually could become a bacterial-related problem down the road if the abscess expands too far. So just the force on a single tooth inappropriately can kill it. And teeth, if you think about the massive amount of orthodontics that's done, you move teeth around to make them look good. Well, it's not just about looking good. It's about distributing the force correctly in such a way that when people, whatever force they generate, is distributed as evenly and as we call physiological. It means it's healthy while it's in function and working.
A lot of our kids in their preteen years were forced by those awful parents to wear braces, and we sort of sold them on the idea of it because, well, you're going to have a fantastic, perfectly contoured smile when this tedious, horrible process is over with. But there's really more to it than optics, isn't there? It's about the distribution of weight evenly on the bite with that band that you put on their teeth.
Yes, and orthodontics has predominantly been sold based on the cosmetic value of the treatment.
Yes.
Whereas the value really lies in orthodontics, in moving the teeth, as you say, so the teeth fit together and function together properly. And when they do that, you'll have far less work to do as an adult in deterioration of your teeth.
Right. Okay. Let's talk about the process. You've described the difference between dentures and dental implants. And we're talking, of course, with Dr. Ron Zokol, the founder of the Pacific Implant Institute. We're talking to an authority here, so please forgive the rudimentary nature of the question, Dr. Ron, but walk us through the process. You're a referral specialist, so a dentist, my family dentist, would refer me to you for advanced activities.
That's correct.
So once my dentist has determined, well, this is a little beyond my scope. I'm going to need to take you to another level. So I come to you with obvious problems. What's the process?
Well, first of all, we determine whether or not your failing or ailing tooth warrants removal and replacement with a dental implant. If we can save it, we will do everything we can to save it.
Okay.
As long as we have the perception that's going to be a valuable tooth for you for a good enough, let's say 10 years. We can spend an awful lot of money on saving teeth to last them a couple of years, and I just don't think the value's there.
Right.
When we can take the tooth out, replace it with a dental implant, and have the potential for it to last the patient's life. And that's really where the value lies. Now, when somebody is referred to me for an implant or phones our office, they may have a dentist or they may not. We'll work directly with everybody's dentist because our goal is not to take you away from your dentist, but to enhance the quality of care that you receive with your general dentist as well as the services we provide. But what happens, we take a look and we say, what's the disease process? Because sometimes you can have a failing tooth without a lot of damage to the bone structure and gum tissue, in which case it's easy.
Right.
But if you got disease, we've got to take care of that disease too, or else it'll cause the implant to fail. So we've got to assess everybody on an individual basis to say, what is a problem that you're having specific to you, and what do we have to do to make sure that what you get is predictable, relatively straightforward, is treatable without discomfort, and gives you a service that will last you a long time.
Okay, so now once you've done that assessment and you've decided that, those teeth or that tooth really should come out, and there's an economic argument to be made in favor of that as well, and so it makes sense to me. So I say, okay, out it goes. So when the extraction occurs, when you remove that tooth, Does the implant process begin right then and there, or is there a healing time, sort of you got to take a few weeks here and let us go through a phase before we can begin implants?
With the lack of disease, an implant placement at the same time in most places of the mouth is warranted. In fact, better off.
Really?
If we can put an implant at the same time.
Oh, so out it goes and in goes the new thing right away.
Right at the same time.
Wow.
And every now and then we can put a tooth on it as well at the same time. Not the final tooth, but a temporary tooth.
Right.
And we got to allow the tissues to heal around the implant
Sure.
before an implant will survive or fail by virtue of the force put on it. So if you put a force on it too quickly and it moves, you'll fail. It'll fail.
So what is an implant, Dr. Ron? Explain the fundamentals of it, because I've just had it. You've just pulled a tooth. So what are you going to do in that socket where my tooth that I was rather fond of is no longer?
Yeah.
Do you put a screw in there?
Yes.
Okay.
Simple word. Yes. And it doesn't have to be a screw. But an implant is something which, if we refer to it as a dental implant, an implant is something, anything you put in the body can be an implant.
Sure.
Could be a hip, could be whatever.
Yep.
Knee, doesn't matter. The point is it goes into the body structure, into the biologic tissues of the body. In our case, we replace the root of a tooth with a dental implant. And then we got to build a tooth on top of it. The dental implant is a round structure, threaded in most cases.
Mm-hmm.
And it goes in to replace that root of that tooth. And it has to stay in there a period of, let's say, 4 to 5 months so the bone can grow around it and grab it.
Oh, I see. Okay. Because there's not much to hold it when you put it in initially, is there?
No, well, there is. The threads that use to secure it as you put it in is are the structures which keep it in place.
Right.
And if it's held in the bone structure, the jawbone structure, very firmly, then you can put small amounts of force on it without it moving, in which case the bone structure will become even stronger than if you put the implant in without any forces going on it. Because bone is a very dynamic part of our body. It has blood vessels, and it responds to the forces that we put on it. Sometimes negatively if the force is too much, but very positively if the forces are there but not exceeded what it takes to keep the implant still in place or stable, we call it. So if we can put that implant in and put a tooth on it without putting excessive forces on it, then we'll get the best result that we could possibly get.
So the sooner you get at it, the better.
Ideally, yes. As long as we know that the implant won't move, we're good to go.
You lecture, you teach dentists all over the world about implantation and the procedures and the processes involved. And yet we're starting to see more and more advertisements for dentists who do implants. Is this option, this therapeutic approach, becoming more and more popular? And are dentists learning about it now at university, or do they still have to go and take one of your special courses?
All dentists today at any university at an undergraduate level learn about implants. They don't always get the training to do it. And if you get into a graduate program in surgery and oral surgery or periodontics and sometimes prosthodontics, they'll train you to do implants to a certain level.
Right.
And such. There is no comprehensive program that I'm aware of that takes a person to the complete understanding of both prosthetics and surgery at a university today. There's a number which get you close. And they're growing right now because the demand is out there, and we're recognizing that without the comprehensive training, then there are difficulties in some cases that the dentist doesn't realize until they get into the procedure.
Right.
So what we're trying to do is we're trying to move forward towards the educational program going into the universities as much as possible.
Now you keep saying we, and there's another party involved here, who's not able to be with us because, like you, he's a popular lecturer and he's out of the country this weekend, as you will be for the next 3 weeks.
That's correct.
But Dr. Bobby Birdie is soon to be a partner and colleague of yours at BC Perio. Tell us a little bit about that.
Oh, this is an excellent story. And Dr. Birdie has developed his own program called BC Perio at 777 West Broadway. And he is a certified specialist in both prosthodontics and periodontics. Those two specialties, which I alluded to before,
Right.
that said, if you have these two, you have the foundation of doing what I do very comprehensively. And this is one of the most credentialed individuals I have ever met in North America. He may be the most credentialed individual who can do what I do, coming from a dental program. He is a very, very good surgeon and a specialist in these two fields, and we're going to be working together for the unforeseeable future.
Will you promise to bring him in for our next gathering here on Boomer Life?
Absolutely, he'll be here for sure. Because
Excellent.
we are partnering. He's actually come in as a partner at the Pacific Implant Institute,
Right.
and we're just forming the relationship of working together in our private practices.
All right. Now, I'm going to take a quick break here. But just before we go, I'm going to remind you about Dr. Ron Zokol's website, which is Zokol, ZOKOL.com, and the address for the current office, which is at City Square at 12th and Cambie, just down the street from Vancouver City Hall. And you're moving into a practice with B.C. Perio and Dr. Birdie
That's
soon.
absolutely correct.
Interesting. So all of that information is available right up to the minute at Zokol.com. And we'll continue with Boomer Life and our dental solutions expert, Dr. Ron Zokol, after this quick timeout.
It's all about the baby boomer lifestyle. Boomer Life on AM 650.